My name is Cynthia Linebarger. I've had high blood pressure since the age of 19. I'm 56 now. I was diagnosed, I want to say, I had an accident at work. I was hit in the head. I was working at Chrysler at the time and got hit in the head with an iron hook. So I kept having these persistent headaches and went to the doctor. Matter of fact, I went to a neurologist. And at that time, I was diagnosed with high blood pressure. I didn't weigh that much, like maybe 125, so I know it didn't contribute to my weight. But I was diagnosed at that time, and also with migraine headaches. At the age of 19, you know, it's a shocker. I didn't want to take the medicine. I was like, I'm too young to be taking this. And for a while, I didn't take it. It was several years, and I didn't take the medication. You know, I would have migraines, not thinking it was, you know, a part of the hypertension, but no. And then it wasn't until later, I want to say maybe 5 years later, I kept having these headaches and went back to the doctor again and was told it was hypertension. And at that time I was put on like 3 different medications. My weight, it went up. And when I say up, the highest I have been was like 200 and almost 30 pounds. And like I say, it was a lifestyle, eating my family, then going out, you know, with my husband at that time, we would eat. And like I said, it was just a lifestyle, you know, eating. You know, I didn't think I was that overweight until one day I looked in the mirror and I'm like, oh Lord, I'm too big now. I've been hospitalized, not for the hypertension, but it did start off as that I had a real bad headache and didn't know what was happening. And I think as, not just as a African-American woman, but just a person, period, you know, we know our bodies. And this particular day I wasn't feeling right. And I had one of the other nurses to take my blood pressure. At that particular time, my blood pressure was 200 over 110. And like I said, I just didn't know, you know, something was wrong. She did an EKG, thinking I was having a heart attack, but it was angina. And I was hospitalized for 5 days. And they had to get my pressure and everything else, you know, back together. I had weight loss surgery, let me see, back in '09. I had it, so it's going on 5 years. And so far I can say, yay, I lost 100 pounds. So, yeah, but I still have the high blood pressure. My doctor, Dr. Charles, he had tried different things, you know, okay, well, you're not going to be on it for a while. So I say maybe 2 or 3 days I could go without it, but then I started getting like the headaches, you know, so I go right back on my medication. My diet has changed as far as fried food. I still eat fried food. At that time, before I lost the weight, maybe 2 pieces of chicken or something, maybe 3, but like the chicken wings or something, a full meal. Now, I might eat a wing. If I'm that hungry, maybe 2 spoonful of maybe rice or potatoes, whatever, you know. A lot of foods now, since I've had my surgery, I can't tolerate like beef. I can eat a little bit. I prefer fish, but I will eat everything else. But I'm a junk food eater. I still eat my junk food. I'm bad with my exercise. Well, when I go to work, I do the stairs. So I'll go down the stairs, I'll come up the stairs. I do a lot of walking at work, period. Every once in a while I will do like squats or something, you know, trying to get the excess skin, you know, to tighten back up in my legs and glutes, everything. But not as far as going to a gym. No, I don't do the gym. Well, Dr. Charles has said he's happy about the weight loss, but then he told me, he said, you lost too much. I said, you were the one that suggested this surgery, which I was happy. The high blood pressure, as he told me, he said, mine just must be hereditary, you know, something in the genes that I still have to take the medication, you know, and I'm okay with it, you know. I've been accustomed to taking the medication, like I said, since I was 19, so, you know, I'm okay with it. Very important to have an open, you know, I don't think you should go to the doctor and, you know, it's just, well, okay, Miss Jones, blah, 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 you know, for any conversation. And the patient, well, which it has been times like that, some patients feel like they can't even talk to the doctor. You know, they can only talk about whatever problem that they're coming in for instead of just sitting down one-on-one, okay, well, this is bothering me, or I'm concerned about my blood pressure, or if I'm a diabetic, you know, about my sugar, anything, you know, you got to have open, you know, open communication with that person, you know, especially if you got your life in that person's hand. Women, when they come to the doctor, we have no shame. We're not embarrassed about anything. We'll talk to the doctor about high blood pressure to GYN problems. Men, I think they're embarrassed because they think, especially when they come to hypertension, that their manhood, you know, they're ashamed of that they won't be able to perform, and they rather go around with the high blood pressure, you know, without getting treated because of their manhood. They're ashamed, well, I can't perform anymore, you know. I would rather have you live and forget about that, you know. That comes with age anyway, so you go ahead and you take your medication. Diet. Diet is most important. I'm happy that my hypertension isn't coming from my diet since I have changed my eating habits. I think most Black Americans, they should get themselves checked out. Not just for mama's sake, daddy's sake, but for your own sake, you know. Just change their eating habits, you know. We can still have our fried food in moderation, but just change, you know, they'll feel a lot better.